In a previous video, we discussed how to set up your gown and gloves in such a way on a sterile surface to prepare for scrubbing in. And this is essentially kind of where we left things, where we opened our sterile gloves first, and then we placed our sterile gown above it, without contaminating the field. Now what we need to do is actually scrub into the case. So depending on where you're working, either you'll kind of do a traditional scrubbing in with a sponge, or you may have the dry scrub material that you'll just kind of grab from the machine and quickly run over your hands. That happens first. However, after you've actually washed your hands, what you'll do is approach the table and begin scrubbing in. So as we've set out our gown here, what we're going to want to do is pick up our gown without touching anything else, and then we'll want to grab it in the fashion here where, this is just a towel. We don't need this. But what I want you to do is realize that this inside of the gown is okay to grab in a non-sterile fashion, because this is going to be touching your body. And just examining the gown here, what I want you to see is that there's these little flaps on either side. This is where you're going to put your hands into when you're opening this up. So it's going to be kind of one fluid motion where you're going to kind of open up the gown and push your hands through the arms of the gown. All right? So the important thing is that you grab it from the table without touching the table, and then you only touch the inside parts here, and then pay attention, because it's going to be quick. You step back to give yourself room, but then you'll just open up the gown, and then here you are. Now everything is sterile on this side, and there is, I'll show you a little bit later, but there's a strap, so hopefully you'll have some assistance to strap you in. There's a strap around your neck and around your waist that someone else will help you to get strapped in. There are also techniques for you to do it on your own. However, most junior trainees generally don't do this because it makes other people uncomfortable, because the techniques require some skill to avoid contaminating yourself. So anyway, you'll open up the gown like we just did, and then now you'll use your hands through the sterile gown to put on your gloves. Now, ideally someone will be tying you up while you are in this position, so you can ask, hey, can someone please tie me up? But regardless if someone's tying you up or not, what you can do is now open up your gloves, and it's in the same fashion. Again, it can be feel a little clumsy because you're working through the gown, but you'll just present the gloves to yourself, and then now what you can do is just grab the glove like so. And again, everything is sterile because we're not touching anything, but then as you kind of grab the glove here, there's a few different techniques of doing this, but you can kind of slide your hand in and then pull back on the gown and just free up your fingers like so, and then just pull your gloves, and then you can kind of adjust, and now you have one hand in, and now it will be a little bit easier. You can kind of expose your fingers on the other hand, grab the glove like so, putting your hands here, a similar technique that we've discussed before, and then you can just slide your hand in here, and now you're scrubbed in. You have your gloves on, you have your gown on, and then there's this little thing right here where you will pass this. Basically, you will take this off like so, you will pass this to someone else, and you'll spin around, and this will help you kind of tie yourself back in. As you get more skilled, you can kind of pass this back to yourself like so here without contaminating anything. But whether or not you tie it to you pass it to yourself, or you pass it to someone else and spin around, you'll tie the final strap in here, and you will be ready to go. And you can always obviously readjust as needed, but that's kind of fundamentally how you will scrub in when you're working on a sterile field, and then you can just kind of throw this all away. And that's pretty much it.